Here you go,
There we
Gina.
go.
Good morning and welcome, Senator Blood, legislative incumbent candidate from District 3. We thank you, Senator Blood, again for joining us for our virtual legislative candidate meetings. My name is Gina Ragland, and with us today are lead AARP advocacy volunteers Susan DeCamp, Bob Lassen, Danny DeLong, and our state president, Dave Holmquist. We appreciate your taking the time to meet and discuss issues of importance to the 50-plus voter in Nebraska. And as a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. Senator Blood, if you want to just jump in right away, if you want to start by giving us a little background about yourself and your campaign, we're aiming for about 5 minutes or less. That would be great. And once we've completed your opening, we'll move into the questions. So go ahead, Senator.
Well, thank you, Gina. And as you just said, my name is Senator Carol Blood, and I currently represent District 3, which is Western Bellevue and Southeastern Papillion, Nebraska. And I am running for re-election so I can finish what I started over the last 4 years. I'm going to start just real briefly with some of the things that I've accomplished. In the past 4 years, 23 of my bills have actually been passed over the last 4 years, and those bills include removing hurdles to employment and improving accessibility to a variety of medical careers, and supporting telehealth services, improving access to personal care home services, addressing mental health issues, holding elected officials accountable when they lack personal ethics, helping our children have access to hearing aids, protecting our military families and Nebraska veterans, providing updated consumer protections, protecting victims of violence, embracing women and mothers, improving our prisons, helping area seniors, and providing solid property tax relief that included $650 million in annual property tax relief for all Nebraskans. You can go to electcarolblood.com to learn more because we only have 5 minutes. So I'm a very hands-on representative, and I'm very proud of that. I do things a little differently than most senators. If you live in my district, you've likely received a call, especially during the pandemic, where we offered assistance and resources and actually arranged for assistance and resources, especially to our seniors who were unable to leave and get help during the start of the pandemic. Outside of the pandemic, we call all of our constituents on a regular basis, and I've done that as long as I've been an elected official, especially when I was on the city council. That's when I first started doing it. Because we want to see if they have any questions, concerns, comments, because I never forget who I work for. It's not District Carol, it's District 3, which consists of people from all parties, all demographics. And that's something I really want to touch down on. I think that makes me different than a lot of candidates is I'm personally sick of the political rhetoric, and I don't participate in it. I have never run a dirty campaign. I don't point out what's wrong or what I don't like about my opponent. I stand on my record, and I stand on my personal values. I think this us versus them mentality is killing this country, and it's starting to tear apart the fibers of our unique unicameral here in Nebraska, and people should be very concerned about this. You know, it's not about the Democratic way, it's not about the Republican way, it's about the Nebraska way and being the very best citizens that we can be. I grew up on a farm in rural Nebraska, and if a neighbor was sick and had cancer or had been injured and couldn't go out and bring in their crops, when we knocked on their door to go and help them, we didn't ask them what party they were. They were a Nebraskan and they were our neighbor. And so I pride myself in the fact that I never forget that I'm a Nebraskan. I'm born and raised here. And I want it to go back to the way it used to be, where we listened first to understand, and we didn't have to agree, but we respected each other. And I think that unfortunately those days are becoming further, more far and few behind us. I am married. I have been married for, I want to say 33 years, somewhere in that area. And I have, 3 adult children and 10 great grandchildren, a great dog, a corgi dog named Ollie, and his sister, Stella the cat. I have had my own business since 2005. I'm a business consultant. I help businesses find affordable ways to start their business, and I help them achieve and find funding and find sustainability. Our success rate is around 90%. I think the national success rate is about 33%. So I feel that I've done an effective job. Prior to that, I ran a Sarpy County Chamber of Commerce. So I think that's probably 5 minutes. I don't have a timer, but I'm going to count on you to let me know, Gina. And I'm happy to answer any questions.
Great. You're very close, Senator. So thank you. Great job on staying under the 5 minutes. Just so we're moving on, because again, I think that the important part of all today's discussion is the questions that pertain to our 50 plus. And so moving into that, we did provide you with a set of the 3 questions. Again, these are issues that we feel are very important to our 50 plus, not only as a constituent, but also their families across the state. So we have allotted 5 minutes for each of those questions. And as I said earlier, our volunteers are going to be the ones that ask those questions. Dave Holmquist is our state president with question 1, which pertains to helping people stay in their homes and communities. So Dave, I'll go ahead and turn it to you.
Good morning, Senator. Thank you for joining us this morning. We appreciate your time.
Good morning.
Senator, a livable community is one that is safe and secure, has housing that is affordable. In other words, no more than 30% of income is spent on housing. Transportation options that allow individuals to travel by multiple means, and supportive community features and services for people of all ages, allowing people to remain in their communities as they age. What steps will you take to ensure all Nebraskans have access to livable communities?
I think that's an important question, and I'm glad that we're discussing this because it doesn't just happen at the state level, it's also a municipal level issue. And I'm going to start with the municipal level. When I was on the Bellevue City Council, I actually wrote the first draft of their Complete Streets program because connectivity is very important to our seniors, transportation, all the things that you just mentioned. But taking it to the state level, I think it's really important that we continue to review and update our state statutes that embrace this mission, that we continue to support affordable funding across the state of Nebraska. That means, like we just did for rural Nebraska, and I did support that, but also urban Nebraska. And then we need to continue to fight for transportation. Many of you may be familiar with what happened with the ENOA, subsidized transportation, and I got involved with that. I think that that's really important, that the people that you elect, that you know that they're, again, be hands-on. It can't just be send your staff. It can't just be I'm there for a picture and I'm going to go. We have to make sure that we are actively involved in the issues that pertain to all Nebraskans, but especially to our seniors, since we know that that's at least 1/3 of our population. I think what's really important that I'm excited to see is the census information. The census information is going to be really important as we move forward to craft and expand these resources for our seniors. Although we have the old census information, we know that things have drastically changed as our seniors are aging more and more. And I'm in the AARP area, as is my husband. And so it's even more important to us as citizens to know that as we look forward in Nebraska, that we're going to have access to good transportation, that we're going to have walkable communities, and then we're going to have choices when it comes to our transportation. I think it's really important that we support standalone nursing care facilities because not all seniors are going to be able to afford continuing care facilities, and we want to make sure that those reimbursements are appropriate for the current economy and our current cost of living, because we want to know that the people that are staying in place in specific facilities are going to have ways to get to the resources that they need to lead fulfilling lives, to lead happy lives.
Thank you.
Thank you, Senator. Our second question is pertaining to health, caregiving, home, and community-based care, and Susan DeCamp is going to take that question. So go ahead, Susan.
Good morning, Senator Blood. Senator, caregivers help older persons live independently at home by providing assistance with activities like bathing, dressing, and performing complex medical and nursing tasks, such as administering medication and wound care. Caregivers often provide these services with little or no training. Will you support helping caregivers with paid leave, respite services, telehealth, and access to education and training? And how will you protect or expand paid services and supports, as well as the financial security that allows more seniors to live independently in their homes and communities?
So short answer is yes, I will continue to do that, and I have done that over the last 4 years. The long answer, and I have 5 minutes on this one, right? So one of the things I think that we're missing at the state level that I'm planning on tackling, and it's on my to-do list for next year or the year after, is that I feel we could easily expand the Nebraska Lifespan Respite Program by finding alternative financial strategies and expanding the caps. I think right now that a lot of people are happy with the status quo, and that is not something that I think that we've done a good job of addressing. I would continue to support telehealth, interstate compacts, and accessibility to services. A really good example, it was my barber bill this year, where if you are a senior citizen who is at home and can't leave to go get a haircut, which is actually true in many cases, especially since the pandemic hit, but also their caregivers, because what a lot of people don't understand with caregivers is that, you know, they have to keep they can't serve others if their vessel is empty. And they are, as, I hate to use the expression homebound, but homebound as much as the person that they're caring for, and they deserve to have the ability to get a haircut. So I'm going to continue to try and find creative bills like that, you know, they're not sexy and they don't make the news, but they help real people in my district. I'll support work and save programs. I actually had one several years ago. For some reason, there's a lot of pushback in Nebraska on those, and I'm not really sure why, but I feel that it's important that we allow people to grow their retirement savings. I would continue to work on eliminating taxes on Social Security. I think it's really important that people have some disposable income. So if they do have a family member that's helping them, usually that family member is also losing out on income. So we need to try and protect revenue for everybody involved. I think we could do a better job of expanding the Nebraska home tax exemption. I think we need to find ways to incentivize outside caregivers, a lot like we do for childcare providers, to train and stay in the field. And I actually have, and I'll talk to Gina about this outside of this discussion, but I actually have some unique income generating ideas that have nothing to do with taxes that I think could fund a program like this. I also think we need to do a better job of updating our Medicaid waivers for our aged adults and people with disabilities when it comes to day services, as our trends and the resources allow us to do. And then I think that we need to do a better job of reaching out to our non-Caucasian communities. For example, I don't know if you've seen the trend, but we have a big influx of Filipino citizens here in Nebraska. And the Filipino community actually has a tendency to embrace home care as a priority choice for a career. And I feel that we tend to forget that we can go to specific demographics, be they Sudanese, be they Filipino, and say, hey, we're going to offer these incentives. We want to help get you trained. We want to help you get involved in the geriatric community. And I think that's low-hanging fruit that when we problem solve, we don't always think about those things. That's probably 5 minutes, so I better stop.
Great. Thank you very much for your answer.
And Senator, we would tell you, thank you for introducing 755. That definitely was a bill that we supported, and there were many amendments into that bill that were very good moves also for 50 plus. So thank you for doing that. Moving on to the third question, which addresses nursing facility quality. Bob Lassen, one of our volunteers, is going to take that one. So go ahead, Bob.
Yes, thank you again, Senator Blood, for being here today. This and some parts of this question are going to be repetitive that you've already covered them, but An estimated 6,600 Nebraskans reside in one of the Nebraska nursing homes, 211 nursing homes in the state. By 2040, the University of Nebraska Omaha projects that number will more than double to almost 14,000 people. Due to a variety of factors over the past years, Nebraska has seen an increase in nursing home facilities having to close, residents having to relocate elsewhere, particularly in the rural areas. How will you ensure that Nebraska residents receive quality nursing home care, including ensuring an adequate nursing workforce, which is a problem in several, education, training, and proper reimbursements?
So again, something that I have been very supportive of already over the last 4 years, but I think we need to make really sure that our reimbursement levels at the state level are consistent with the needs of our nursing homes and other like facilities. I feel like Nebraska can do better than we've done. I think it's really important that we support funding efforts for geriatric related jobs, as we've done in the past for other medical careers. There seems to be a push to take away funding from institutions of higher education right now, which I don't understand. I think it's more a matter of offering the appropriate programming to make sure that those graduates can actively find jobs. And how do we incentivize? Again, I go back to providing incent, as we've done for childcare providers. And what we do for big businesses to come and open their doors in Nebraska. We're very quick to incentivize, and I do support that, to bring business into Nebraska because it provides jobs. But we're not as quick to provide incentives for people who want to care for our seniors. It's almost like you become a senior citizen in Nebraska and you're in stealth mode. And I find that concerning, and that makes my heart hurt. I think that we should update and make resources better on the Nebraska Lifespan Respite Network. I think that the network isn't easy to use right now, and to search for accurate information, I think it needs to be found more quickly. When somebody, I always refer back to my office. If somebody calls our office and they're in a crisis, I don't care if they're my district or not, they're a Nebraskan. When you're in a crisis, you want help now. If you're a caregiver, you're at a wit's end, you're trying to provide services, you're trying to balance your family, your job, maybe somebody's illness, or be it dementia or whatever is going on, you don't have hours to spend on a website. You need help fast. I think it's important that we continue to work on our interstate compacts. I've been a big proponent of interstate compacts because that helps bring people to Nebraska and lets them hit the ground running to get to work. I think that's very important. To put it into a nutshell, we can just do better when it comes to our nursing facility, the quality, what we provide, how we fund it. I am really truly hoping that this most recent census helps really put this issue in the forefront as far as how important it is. When a lot of us were growing up, if grandma or grandpa got sick or needed a little extra help, or maybe couldn't get up and down the stairs as easily, you moved them in with you. And that was just an accepted fact. Then there became this thing where we wanted to put people out of sight, which I've never really understood. And, we don't have to worry about mom and dad now because they're somewhere else where we can take care of them. Now we're finding, because it's so cost prohibitive, we're going back to what it was like when we were kids. But the difference is now more people work than they did when I was growing up. And so you're trying to juggle all of these things. So we need to make sure that whatever we do policy-wise addresses all of these changes that are going to, I think, be clear when the census comes.
Thank you.
Thank you, Senator. So that concludes the questions, but I do want to open it back up to the group. We have a few minutes before we go into your closing. Does anyone have any additional questions or comments that they would like Senator Blood to address? If not, Senator, go ahead, Bob.
Okay, well, just a quick one. Now, you mentioned developing a program to incentivize people to go into senior health care, and you mentioned what they did for childcare. Could you expand on that just a little bit?
Yeah, there are a lot of creative ways to find funding for incentivizing. And I'm not just going to talk about Nebraska, I think I'm going to talk nationally. So one of the ways that they have incentivized programs like that is to actually utilize gambling. One of the things, and again, I want to be really cautious how I explain this. Right now, there is a type of programming that goes on that pertains to sports. And it is not considered by the federal government to be gambling because it takes skill. So, and it's not sports betting, and I'm drawing a blank, and I apologize right now. Fantasy sports, there we go, fantasy sports. So right now in Nebraska, fantasy sports is going on, period. It's going on, we can't stop it, but it's not being regulated at all. The industry wants to be regulated. So if we regulate that industry, for those that are anti-gambling, you would think that you would want to have them under our thumb, that we can see what's going on and that they have to follow the rules that Nebraska sets for them. But we have this anti-gambling community that says, no, if we go ahead and regulate it, then we're just supporting gambling, even though the federal guidelines clearly say that this is a game of knowledge. You have to know your football players, your baseball players, and what their skills are, right? You're not pulling a lever and letting the universe decide whether you're going to win or not. And we have this ability to generate income from that, as they have in other states, and utilize it for services like helping our people get trained for the geriatric community, much like they do that in communities where they incentivize child care providers to be better educated and to stay in that job because the pay is so poor. And we have to find ways that have nothing to do with taxes to generate that income to make sure that these people can receive better pay, better training, and not leave the geriatric community for a job at McDonald's, because McDonald's pays better than taking care of a loved one.
Thank you.
Sorry for the stutter for a minute. It took me a minute to grasp. I haven't had my caffeine yet.
To all of us, no worries at all. Thank you, Senator Blood, for joining us. And again, we are coming to the end of our time. But as we end our meeting, we always want to let you close with some final comments or thoughts that you might have for our group or the constituents that you represent. So go ahead, and there's about 4 minutes left for your closing.
You know, anybody that has taken the time out to watch this, I just want to remind everybody that if you don't vote, your voice isn't heard. And I don't know how many times we've proven over and over again that one voice and one vote truly makes a difference. So whether you vote for me or don't vote for me isn't as important as the fact that you please vote. I also ask that as a Nebraskan, you remember what the Nebraska way is all about. It's not about you being a Republican. It's not about you being a Democrat. It's about us working together, working across the aisles to get things done. And we can get things done, and we can do a better job if we hear from you. And if you go to the polls and you vote for the people that are like-minded in a way that you know that they're going to do what's best on your behalf. Not special interest, not my personal likes and dislikes, because there are many things I often support that I personally don't support because I want to be the voice of my district. I want to be the voice of Nebraskans. And don't ever hesitate to call your representatives, to call your candidates, and ask them the hard questions. Don't listen to rhetoric, use facts. And with that, if you want to learn more about me, go to my website at electcarolblood.com. Also, I give out my personal cell to all my constituents, 402-517-1446. Don't hesitate to give me a call if I can chat with you on any issue.
Great. Thank you so much again, Senator Blood, for taking the time to visit with us. I know you're in the busy season, you're out campaigning. We do wish you the best with your campaign. And again, thank you for meeting with AARP today.
It was my pleasure.
Thank you.
Thank you. Go ahead, Gina.